be able to define assessment. You will also have an understanding of traditional and ongoing assessment methods that can be used. You will be able to compare traditional and ongoing assessment methods, and you will be able to have an understanding of assessment within the learning support process. You will also have an understanding of the practice of assessment in inclusive classrooms, be familiar with the principles of assessment, and understand the theory that underpins the national strategy on screening and identification, assessment, and support. So I just wanted to start off by conscientizing us about the fact that there's an increase in the number of children identified as having learning disabilities. So the question is, like, why are more children being identified with learning disabilities? And so you might have noticed that within your own context, perhaps. But why is that? Now, there are a few reasons, I believe, for the increase. Yes, Tanya, I see your hand.
Sorry to interrupt. We're struggling to see the presentation.
You're struggling to see the presentation. Is it not moving?
It just says can't display presentation.
All right, let me try and stop sharing and then share again.
Thank you.
Thank you for letting me know. I appreciate that. Or maybe I should switch off my camera. I don't know whether that will help. Let me switch off my camera. Perhaps that will help. Please give me a thumbs up if you can see the slide. Can you see the slide? Jessica? Jessica, your hand is up.
My apologies, sir. I meant to press the react button.
Okay, so I just want to confirm as well, while you have your mic on, Jessica, can you see the slide?
Yes, I can.
All right. Okay, so just please do stop me if there's a glitch, if the slides stop moving and what I'm saying is not correlating with what is on the slide. Please notify me so that I just don't continue, but stop and just recap. Okay, so there are a few reasons for this increase, of course. And so when you look at literature, you will see that one of the reasons for the increase is awareness. People are just more aware of learning disabilities now than ever before. Parents, teachers, even the Department of Education, as well as learners, are all pushing schools to make sure that learners with learning disabilities get the support they need. Literature is also uncovering that it is due to better identification and evaluation processes that have been put into place. Now, over time, the way we assess and diagnose learning disabilities, that has improved. And these advances have made it easier to identify learners who might have gone undiagnosed in the past. And then we also have the social acceptance that plays a part in the increase. And a lot of parents, as well as school administrators, prefer to classify a child's condition as learning disability because it comes with less stigma than other labels that have been used in the past. For example, like mental retardation, which is a term which we obviously don't use because we now use the term intellectual disability, as well as other behavioral disorders. Now, this shift means that more learners who might have once been labeled with those terms are now being diagnosed with learning disabilities. In fact, when we dive deeper into literature, the number of learners or the number of children labeled as intellectual disabled has actually dropped significantly. And so we also uh, we also are aware of the fact that an increase is also due to the fact that the Department of Education has started really enforcing White Paper 6 as well as the CIAS and the SNAR framework, and have conscientized mainstream and remedial settings about the importance of using that framework in order to identify learners perhaps with barriers within their classrooms, so that support is initiated. And so we find that these systems and these awareness have allowed for the increase of learning disabilities to suddenly being identified within the context of South Africa. And so when we think about the context of South Africa and how many children have learning disabilities, we find that in South Africa, statistics shows up to 70% of children with disabilities aren't in school, which is a huge barrier to education. Now, the statistics include all disabilities, not just learning disabilities. As for specific learning disabilities, which is also known as SLD, one study found that students with SLD in special education schools in South Africa showed resilience despite limiting resources, though no specific percentage is given. And I've highlighted this in our previous orientation conversation because I really want us to be conscious about this reality, the absence of data within this framework, because for me, the absence of the data really just doesn't inform us about what it is that we need to do, and what it is that perhaps we need to relook at that is not contextually working. And so as South Africans, we really need to start perhaps investing on gathering data in regards to how the specific learning disability, how it currently looks like in the South African context. For autism spectrum disorder, that is ASD, in the Western Cape, literature has uncovered 0.08% of learner population that was identified with this disorder. And the number of diagnoses has been rising in recent years. And this figure doesn't cover all learning disabilities, though. And then we also have the global statistics that is out there, which has identified about 8.4% of children under 5 years old who have been diagnosed with developmental disabilities. And while this gives a broad sense of the issue, it's not specific to learning disabilities or the South Africa context. And so we need to be conscientized about the absence of data within the context of South Africa, but also the reality of what you as teachers are currently engaging with within the different contexts that you find yourself. And that in itself should indicate the need for more teachers to be equipped in terms of how they can use scholastic assessment or assessment processes in order to bring about intervention strategies for learners. Hence the importance of this module, which is part of the program. And so when we think about the statistics that we've just looked at, it really just highlights the alarming attention that it is required because of the diversity of learning disabilities that is found within the South African landscape. And when we talk about learning disabilities, it's important to keep in mind that they can look different from one person to another. And Dr. Fourie alluded to that because there are different models that give definition to how people have come to understand what learning disabilities is. For example, some learners may struggle with maths, while others may do just fine. Some learners have attention issues, but others don't. And the way these issues show up can change with age. Hello?
Hi, Mr. Deon. Sorry to interject, but can the other colleagues confirm if they can see after the lady said she can see on her side the presentation? Because I've sent a snipping tool and we're raising our hands, but I'm seeing that you can't see our hands.
Okay, so is it not showing on yours?
Okay, so fine. On my
so
side,
what is the
I'm
thumbs
fine.
up? What is the thumbs up for? Can you see?
It's
I
showing
can see on my side.
Okay,
Okay.
and can you not see
No, let me
Penny?
leave and rejoin again. Let me rather leave and rejoin again.
Okay, let me try Petini. Let me try and reload the slide. And then if that doesn't work, then you can leave and rejoin again. Is that fine?
Okay. Thank you so
Okay.
much. I would appreciate
Not a
it.
problem. I will stop sharing. Okay, I'm sharing again. Petini, just give me a thumbs up on your side if you can see it now. Petini?
No, I can't see it still. It says can't display presentation. Tanya Rock hands is also up. Maybe she's experiencing the same.
Yes,
Tanya.
Tanya.
Yeah, I am. Mine's
Oh.
also showing the same thing, and I've rejoined quite a few times, and my connection seems to be fine.
Okay. So there seems to be a glitch in the system because some can view, others can't. You say that you have exit and you've rejoined, and I have now reloaded it again, and you still can't view it.
Yeah.
All right. Okay. Let me stop sharing again. Let me try this again. If this doesn't work, then please take note of what Dr. Fourie said. I will have to make a recording perhaps and post that on the group.
Or could you maybe post the slides in the chat and then we can just follow along on our side?
Of course,
Thank you.
that can work.
Thank you.
That if I can do that, that is amazing. Okay, so let me see. This is the first time I'm going to do this. Tanya, can you perhaps speak me through this? How do I share on the chat?
I'm not quite sure. I've never done it before, but I think it's possible.
I'm just reading
If
where.
you, sir, if you go and you close your PowerPoint presentation and you go and find it where it's saved, wherever, if you've saved it on an external or on your computer, all you do is you click, you right click on it, you copy it, and then you click where it says type message, and then you right click and you paste there again.
Okay, so I say share. All right. Can I create PDF and share link? I will share the link. All right. I'm going to throw it into the chat box now. Paste.
Yes.
What has happened now? Paste.
And
There
then you
we
click
go.
on the little send arrow.
Okay, there we go. There should be a power. Okay, you've taught me something new.
Okay, so we found it's on, so we can all access it.
Okay, perfect. Thank you for teaching me.
It's a
Okay,
pleasure.
so now I know something new.
Thank
Thank you
you.
so much. Okay, so I'm going to share the PowerPoint again. Everybody can view it from the chat, right?
Yes, we can.
Okay. And how the screen is showing, can everybody see the screen again? Perfect. I see fingers are up. All right. Thank you for that. I really do appreciate the upgrade in for IR. Okay, so where were we? We were talking about diversity of learning disability, right? And I was just giving examples about how a learner can struggle perhaps in one thing and just to find in another. And I've also given a similar example. I've given a similar example in terms um, of how somebody with attention issues can perhaps struggle with that, but flourish in other domains. And so there's also the example of perhaps children with a language disorder, which might show up or which might manifest in terms of their speech when they are little, but as they grow, that might show up as reading difficulties in primary school or writing issues in high school. It's important, therefore, I think, to understand that the signs and symptoms can vary depending on the age of the child, and not all of these characteristics will be present in every learner. And here is just some common signs of learning disabilities that I want to share with you, which will be elaborated on later on in our other units as well. And that is attention issues, that is hyperactivity, distractibility, short attention span. There's also the cognitive struggles, where a learner might have trouble organizing thoughts, using active learning strategies, or thinking critically. And then also motor problems, where a learner struggles with fine and gross motor skills, like being clumsy, or having trouble with hand-eye coordination. And then we have perceptual issues, and this is where a child might have difficulty distinguishing between sounds or visual cues, and trouble with things like sequencing. And then language problems as well, where a learner might have trouble listening, or speaking, or even understanding vocabulary. And then we have the reading issues, where a learner perhaps struggles with reading comprehension, or decoding of words, or even reading fluency. And then we have writing struggles, where the problems can manifest in terms of spelling, handwriting, and writing effectively. We also will be looking at maths difficulties, and these difficulties in maths are looking at skills like arithmetic, or time management, and then also just social problems in general, so that as assessors, you understand the difficulty the child have with perhaps social skills, or emotional challenges, or perhaps forming relationships. So the learning disability population in the primary school level, for me, is honestly a silent crisis, because learning disabilities aren't a single syndrome, but it is a mixture of symptoms and behaviors that can show up in different ways. Now, researchers have spent a lot of time trying to figure out how to best categorize these difficulties. And there have been over 100 studies trying to define and group the different types of learning disabilities. And in the past, researchers have come up with useful ways to group learning disabilities. For example, they divided in I think it was in 1984, they divided them into two. And that was developmental learning disabilities, as well as academic learning disabilities. In regards to developmental learning disabilities, there are the basic skills like attention, memory, perceptual skills, and language that the child needs before they can dive into more complex academic subjects. And then there was the academic learning disabilities, and these referred to difficulties that show up in specific academic areas like reading and maths and writing. And today, it has been combined under the umbrella term neurodevelopmental disorders. And so we need to therefore understand that the learning disabilities in primary school is a silent crisis that needs to be attended to, because as they get older and the work gets harder, they may start having problems in subjects like social studies or even science, right? But for many kids, learning disability really first becomes obvious when they start school. They may struggle to pick up reading skills, but the issue can also appear in subjects like maths and writing, like I've said. In the early primary school level, learners often struggle with focus and motor skills, like holding a pencil or even writing and learning to read. Hence, the tools that you were given as part of your SNA 1 and your SNA 2 and your SNA 3 focuses on those areas. But we also understand why intervention is important at that level, because emotional issues also can become part and parcel of the reality of the learner as the learner grows older, because they become aware and concerned after having repeated failures. Now, learners, they start to notice that they're falling behind in comparison with their peers, which can lead to frustration. For some, social issues become more prominent as they have a harder time making friends. So how does assessment help? Right now, assessment is the purpose of just gathering information to help make decisions about a learner's education. And there are two main reasons we assess learners, and that is to classify the learner and to improve instructions. Now, in the past, classifications of learners was only done within the special education settings. But we know that the law that is currently in place requires for all students who are at risk to be classified so that they can be given an equal opportunity to education. It is also to improve instructions, right? Now, the most important, and I think, I think for me particularly, for me, that is the most important reason for assessment, for assessing a learner. Because it is to help learn. Therefore, assessments help teachers plan instruction and tailor it to meet the learner's needs. For me, I really believe, and there's a lot of literature out there that supports the idea that the closer the connection between assessment and teaching, the more effective the process will be. So assessment can serve 5 purposes, and that is screening. And screening just refers to identifying students who may need more support or further evaluation. And the second is referral, and asking for, in terms of referral, this refers to asking for input from other professionals, such as educational psychologists or social workers or nurses, or other school staff, to gather more information about the learner. And then there is classification, and this is to determine if a learner is eligible for either curriculum differentiation, which is from primary school up to grade 9, and thereafter it becomes accommodation from grade 10 to grade 12, or it can sometimes mean referral to a remedial or a special service school. And then there's the instructional planning, and this is to help teachers create a plan for the learner's education. This is important because I want to conscientize you that whatever you're doing in this module has an impact on to how you will, if you are doing learning support, how you will be putting together or approaching the questions in order to put together an individual educational plan for the learner. And and lastly, monitoring progress, right? So this is just to make sure that checking in on the learner's progress through various methods is applied, and this can be done through methods like tests and observation, or even curriculum-based assessment. And what assessment is not is basically to refer a student or a learner somewhere. And I think I've had a lot of conversations with teachers who have informed me that that they struggle to get the buy-in of parents in the process. And that is because perhaps parents are still informed that that if there is something wrong, or if there is a barrier that the child is currently struggling with, that the child will be referred to a special service school. And I think parents need to be educated of the fact that that the department and the law has made provision to learners being supported within the mainstream schools. And I think if parents are more aware of that, that they will buy into the services and the availability of the help being offered by the department through the process, the CS process. So this basically then brings me to looking at the models of assessments, and there are different ways to assess learners with learning disabilities, and schools might use a mix method. And I want to just highlight 3 main models that is applicable to the exercise that you are called to do in the assignments given in this module. And that is the traditional assessment. And so with the traditional assessment, this is the most common model. Now, learners are normally evaluated because they're struggling academically, like you were advised to identify a child who is struggling academically and then to test to figure out why, what could be the barrier. And the goal is to identify deficits and to determine how the learner can be helped, right? Not sent to a special service school or remedial school, but how the learner can be helped. And then we have dynamic assessment. And with dynamic assessment, this model focuses on how well a learner can learn in a teaching environment. And this connects to the model which Dr. Fourie spoke about, and that is the social ecological model, right? And so the environment is important. And this type of assessment is quite flexible, and it focuses on the learner's ability to learn given support, when given support within the environment that the learner is currently in. And then we have the curriculum-based assessment. Now, this method uses the learner's actual work or material just to assess how well they're doing in the subject that they are doing. And it also links the assessment to the specific curriculum being taught, because then it will give you an indication whether the child has mastered the level, the content level or the grade level content in which he or she is. Therefore, informing you already about a question that was asked in the previous session regarding if a learner struggles in a certain grade in terms of engaging with the content, can one go back a grade lower in order to just gauge where the child is functioning? And I think Dr. Fourie called it straddling. And so by virtue of looking at the curriculum-based assessment, all of that will inform the premises of what it is that you perhaps need to consider being part of the individual educational plan that needs to be put together, but which is informed by the scholastic assessment process. And that brings me basically to the following. And that is just the parent the consciousness that I want to bring to you, that all paradigms have a context. And so when we are engaging in scholastic assessment and we making use of the assessment models that I made reference to, I need us to keep in mind also the social ecological model, which encourages us to look at an individual holistically. Now, here at UJ, the social ecological model is at the heartbeat of how we engage with learners and communities. And that informs an asset-based approach, which takes into its fold all of the three assessment models that I made reference to. And that is because we are trying to balance and to not lose the assets from this exercise that you are engaging in. As much as you will be identifying the deficits, it is important that we identify the strengths that these learners might be bringing to this exercise and acknowledge those strengths as far as possible. Dr. Fourie spoke about the medical model, and so we need to be conscious about the move that has taken place um, in terms of how we engage, view, and label people. And the asset-based approach conscientizes us about that, because strength lies in identifying patterns of thought and actions, and then putting interventions in place that will cause tension, which in itself can produce results, and then include cultural understanding or explanations of abnormal behavior as well. And so that is just a core of being culturally sensitive in the context that you are in as you work with the child, considering what are the cultural factors that might influence why the child is performing the way he or she is performing. And so lastly, I just want to, well, not lastly, but as important, I just want to highlight that the law plays an important role in how we assess learners. Now, the law has really influenced social policies, assessment practices, and educational standards, just to ensure validity, reliability, and fairness. And we know that in terms of social policy, that the law is advocating for transformation and inclusion, as well as adequate child welfare, and allowing children or giving children the opportunity to become, in terms of employment equity. And then also the assessment process that have been influenced by the law is the influence on the psychometric test practices and how it needs to be applied, but also the use of technology that is embedded in assessment. And then we also have the law that speaks into the educational standards that informs the standardized tests, as well as the assessment driven tests that is put in place. And if we read through the white paper 6 and the CS document and the SNOB process, we will see that it has been intentionally put together in a way in which it meets the criteria of validity, reliability, as well as fairness for the child in South Africa. Now, we also need to be cognizant of the fact that there are procedural safeguards that have been put in place. Now, these procedural safeguards are rules in the educational white paper 6, as well as the CIAS and SNAS, that really protects the learners who have barriers, as well as their families. And here's just a quick summary of those protections. The first is that parents must consent in writing to have their children evaluated. And so you will find that that was the first call to action in this module. And then secondly, the assessment must be conducted in the language applicable to the learner. In other words, the assessment must be conducted in the learner's home language, and the results must be shared in that language, even if it is written down in English because you will be submitting it. But when communicating the findings, it's important that if the parent is Afrikaans, that you are able to translate that for the parent so that they can understand it a little bit better. In terms of the student's home language, if the student is not being tested in a language other than his home language, it is important that that you make mention of it. And we will elaborate on that in our next session, especially when we're looking at the second language problem that does exist within the South African context. And then thirdly, tests used for evaluation must be free of racial or cultural biases, though it can be challenging to eliminate bias. We need to be cognizant of that. And then lastly, parents have the right to see all the information that's collected about their child during the assessment process. And so we need to keep these procedural safeguards in the front of our consciousness at all times throughout the year as we work with the case child that we have chosen to work with. And then Dr. Fourie spoke about parental involvement. And I also just want to highlight the importance of parental involvement within the whole process. And I just want to also emphasize the fact that involving parents is not calling parents when there's a problem. I think educators need to make it a way of life where relationships are established with learners' parents at the beginning of the year so that parents can be involved and part and parcel of the learning process of their child. And then also it must be planned properly and communicated with the parents. It is important that communication remains open throughout this entire process with the parents and that communication is clear. Parents know what to expect and parents know what you expect of them. And then also continuous updates and capacity building is needed for all parents, not just SGB members, right? I think that is very important because it will just alleviate perhaps the resistance from parents when it comes to having conversations about putting interventions in place, especially for their children. I think parents need to be educated about the help that is available. And I think that will lead to less resistance from them. And then second to last, working together programs are needed. I think that is important because interventions shouldn't just be school-based, but interventions should, a holistic intervention for me is interventions that really boils over into whatever is planned for the child continuing at home. And so parents need to be part and parcel of the process. And so the program in itself, which you need to set for learning support, needs to be holistic, and that will be informed by how you choose to approach the practice that you are called to undertake within the scholastic assessment module. And then lastly, effective communication per phase is needed. That is very important. I think as you work through the different assignments and as you work through the different sections of the assignment, it is important that effective communication is kept throughout the phase. I do want to encourage you not to try and sit the child down, um, all at once, to do all of the task that is set out in the assignment, because that will not give you a true reflection of how the child performs, because children will show up differently on different days, and that in itself um, should inform um, the data. For example, meeting the child in the morning will perhaps have different outcomes to meeting the child in the afternoon. And as an assessor, you want to have the best of both worlds. Therefore, arranging certain sessions to be intentionally in the morning and certain sessions to be intentionally in the afternoon, so that you can just gauge the attention, the attention span and the functioning of the child within the different time frames, um, um, which will enrich your data, give a much more holistic view of the child that you will be working with. And that is the end of my session. These are just references that you can perhaps go and read on that has informed today's talk. And I just want to close by saying that intervention efforts are more successful when offered at the earliest point in time, especially through the preschool years, right? And so intervention for children with intellectual disability are matched by the child's individual needs and abilities, and are integrated with the family and school and community. And then lastly, successful intervention often include behavioral-based training and educational competence that teach specific skills and reduce undesired behavior. With that being said, I want to now call the session to a close and perhaps open it up to questions if there are any. I see Angela, is your hands up?
Sorry to bother you. So I just had a question with regards to assignment 1.
Yeah.
The case child that I was originally working with, the parents said that they no longer wanted to do the remedial and that with me and all that, which is fine. I just wanted to find out, I'm going to use the interview for this assignment because I haven't met a new case child yet. I only meet them and the parents next week. So I wanted to find out with the next assignment, do I then just add the new case child's information with the next assignment?
Angela, if you're not going to go forward with this case child, I would recommend that you reach out to me privately and perhaps ask for an extension, because your first assignment basically sets the foundation for the case child that you will need to continue working on. And I would feel comfortable you asking for an extension, dropping me an email asking for an extension for assignment 1. That will give you enough time just to do justice to the process in itself.
Okay, thank you, sir. I will do so immediately.
Okay.
Thank you.
No problem. Are there any other questions? We have about 3 minutes before I give over to the other lecture. The recordings from the previous meetings can be found on your Moodle platforms. Please be advised to go into each unit in order to view the videos that have been loaded up. This session will also be put onto Moodle by the latest Monday's week. We have about 2 minutes. Do we have any questions? Please take note that you are more than welcome to ask for consultations with me, apart from the tutorial support that you're already receiving. You are more than welcome to drop me an email request, a consultation that can be online or it can be face-to-face. And so I invite you to do that. If there's no questions, I want to call the session. Okay, I see Selena. Your hand is up. Yes, Selena. And then Jessica. Okay, we have 1 minute before the next lecture. I'm going to stop sharing.
Okay, thank you, sir. My question is on the consent forms. Are we going to have new consent forms for this phase from the parents?
The consent forms is initiated at the beginning before engaging with the intake interview with the parents. So what needs to happen is the consent needs to be given. Thereafter, the intake with the parents can happen and all else will follow. But consent needs to take place before anything else happens. Is that clear, Selena?
No. I'm asking if we are going to get consent from the parents for each phase of the assessment.
No. Okay. You only get it once. You only get the consent once, and that is why it needs to be written down, because that consent is for this entire process.
Thank you so much for the clarity.
Not a problem, Selena. Glad that I could help. I think it was Jessica. Jessica, was your hand up?
Yes, sir, it was.
Okay.
So, sir, I just wanted to ask for my own personal information, right? So if you get a situation whereby a parent, I don't know if it's the right term to use, if they're in denial that their child has got a learning difficulty in the classroom, yet you have maybe shown them evidence and have done all the checklists and whatnot, and then maybe let's say the parent is in denial or they are not in agreement that their child has a learning disability. So then what steps do you take in order to assist that child? Because now I don't think it would be fair to carry on with an intervention whereas the parent has not given you consent. Thank you.
That is correct. Right, Jessica? I would say that the premises would be to try and find out what is informing the parent's perception. And once the parent shares with you their perception, that is an invitation for you as an educator to speak into that perception and perhaps try and educate the parent, because it could be because of, stigma. But I think, Jessica, the starting premises would be for you to engage with the parents. Just understand where the parent is coming from. And once you understand that, use it as an opportunity to educate and to liberate and to bring the parent to a place of understanding how beneficial this process would be. Okay, Rachel, last question. I'm going to get into trouble. Rachel, last question.
Morning, everyone. I'm in the same boat, I think, with Selena, whereby I've met 3 parents, all in denial. The last one I was supposed to meet, that's what I'm even talking about, if I can get an extension, because I'm really hitting a brick wall.
Okay, so
this
if
parent
you do need
now, which I've got, at least he is willing to go through with the process of helping me with my assignment. while
Yeah.
we're doing the assignments. But now,
Yeah.
I don't know.
No, I hear you, and a lot of you. That is the reality, and that is, I think, why it was part and parcel of the conversation in the lecture, because that is the reality. But that reality also needs to conscientize us of how educators need to be, um, um, but now educators need to be up to date in terms of their awareness of what learning disabilities are all about, so that they are empowered to empower um, parents. And I just think it is because of a legacy that has been inherited and parents not understanding. Therefore, it is important for educators to understand so that they can share those understandings with the parents in terms of educating them about the processes in place, but also about the barriers um, that their children might be navigating in their learning experience. So thank you so much. Dr. Furi, over to you.
Thanks very much, Mr. Deon, and thank you for all the clarity given. We understand that we are navigating complex spaces, and so there are always ethical considerations we need to take into consideration as well. Okay, so I'm going to stop this recording, and I will send you the link to the recording later.
Thank you so much, Dr. Furi. Thank you so much, everybody. Have a good Saturday.